Well, it's time now for our twice-weekly In Focus Health Update. Health reporter Linord Moudou joins us now with an in-depth look at polio. Hello, Linord.
Hello, Vincent. Hello, everybody. Poliomyelitis, known as polio, is a viral disease that can lead to partial or full paralysis. Most countries have eradicated the disease, but health advocates say the fight against polio is far from over. This is the world-famous sand sculptor Sudarshan Patnaik. He has created a sculpture using 20 tons of colored sand on a beach in Puri City, India. His goal is to spread the message of polio eradication.
We thought of spreading the message of End Polio Now through the sand sculptures among people, and it will help in starting the campaign. We have recreated the sculpture at a height of 7 to 8 feet using 20 tons of sand. The basic motive is to spread awareness among people to end polio.
It took Patnaik and his team members over 4 hours to complete the sand sculpture. Children and tourists gather at the beach to appreciate their efforts.
Now it's the time for all of us to realize and to come up to join our hands with the Rotarians to eradicate this greatest disease of polio so that our future children will be healthy.
Polio spreads in areas with poor sanitation, attacks the nervous system, and can cause irreversible paralysis within hours of infection. Children under 5 are the most vulnerable. The World Health Organization says India has recorded a significant drop in the number of cases of the debilitating disease, which WHO attributes to vaccinations and surveillance of migrant populations. Meanwhile, the United Nations Children's Fund, UNICEF, says it is concerned over a fresh outbreak of polio in Nigeria. Nigeria pledged in September to eradicate polio within 2 years, launching the Polio Free Touch campaign to mobilize support for the last lap of polio elimination efforts in the country. About 40 new cases of polio have been reported in several northern states. Edele Thibault is UNICEF Chief Field Officer in Kano.
We have to recall that Kano, which used to be the epicenter of polio outbreak, was indeed polio-free for 16 months. From January 29 to October 2010, before it detected only 1 case in 2010. But the picture this year is very worrying.
As of today, polio still remains in 4 countries: Afghanistan, Pakistan, India, and Nigeria. For over 2 decades, the worldwide organization Rotary has led the private sector in the global effort to rid the world of polio. Joining us on the phone from Chicago, Illinois, to give us an update on the fight against the disease is Carol Pandak, manager of Rotary International's Polio Plus program. Ms. Pandak, welcome to In Focus.
Thank you very much.
Now, when the polio eradication, the Global Polio Eradication Initiative was launched in 1988, there were more than 125 countries that were polio endemic. As of today, only 4 countries remain. What is lacking in this country that, what is missing that is making them still polio endemic?
That is correct. There were 125 countries that were endemic for the polio virus, and now we're down to 4. I think the challenges that we face now are very unique to these particular countries. You have civil conflict in countries like Afghanistan and Pakistan. We need to increase the quality of the implementation of the polio campaigns. We need political will and additional resources in order to finish the job.
Now, additional resources, what are we looking at?
Currently, there is a funding gap through the end of 2012 of over $500 million, and it is imperative that that funding gap be closed in order to fully implement the Polio Eradication Initiative strategic plan.
Now, there's no cure for polio. What are the tools? I know vaccination is definitely one of them. Tell us about that.
Of course, we have a vaccine, the bivalent polio vaccine that acts against the two types of polio that remain in the world, type 1 and type 3. But another important element is getting the word out to parents to have their children immunized, that it's safe to have children immunized, the benefits of having children immunized against polio so that they don't suffer a lifelong threat of paralysis.
Now, how do you avoid catching polio?
The only way to avoid catching polio is to be immunized against polio. Once you have polio, there's no cure. So you suffer a lifelong paralysis, and so there is no cure. It's a preventative disease, so you need to immunize in order to protect children from polio.
Now, there are 4 countries remaining. Do you think that it will be at all possible to have a world free of polio anytime?
Oh, absolutely. I mean, there's no question that the world can be polio-free. And I think the fact that we're down to 4 countries, and in some of those countries it's very limited areas where polio still circulates, it's just you really need to have intensive political support, advocacy with governments in order to get over this last 1% of cases. But it's important also to note that while only 4 countries have never stopped the transmission of virus, there are a handful of other countries, especially in Africa, that have suffered importations of the virus. So there are actually 12 countries in Africa that are reporting cases of polio.
Okay, and that's all the time we have. Ms. Pandak, thank you so much for joining us.
Thank you.
Well, polio can leave